As coronavirus cases continue to climb, doctors say they have noticed drastically, fewer flu cases this season. There were some concerns before the flu season started about a so-called twin-demic, but health experts say thankfully that has not happened. According to the Centers for Disease Control, patients visited a healthcare provider for flu symptoms. It's way low, below last year, in fact, just 1.7% of visits reported this week compared to more than 5% during this same week last year. New tonight, we have a series of reports for you, including a conversation with a doctor who says she has seen basically no flu cases this season. But first, News Nation's Marky Martin is live for us in Texas, looking at why the so-called twin-demic didn't happen. Good evening, Marky.
Hey, Marnie, yeah, we crunched the numbers from the CDC today, and nationwide, the flu has just plummeted this season. And, you know, typically we see those flu cases spike between December and February, but health experts say with this global pandemic very much still in play, COVID has actually kept other seasonal viruses at bay. It was only a few months back, late summer, when health experts warned of a looming twin-demic.
We're recommending that everyone wear masks. Of course, you've all heard that because of COVID, but masks will also help us protect against influenza.
The potential double whammy of the flu and COVID-19, launching a nationwide campaign for the flu shot like we'd never seen before.
You're not sure if you are having a sore throat or a temperature, if it's the coronavirus or maybe the flu.
But fast forward to January, and it seems the U.S. has ducked the duo. COVID, of course, still rampant, with the national death toll reaching 400,000 just this week. Influenza, however, has all but vanished.
And it really speaks to the fact that COVID is far more contagious than influenza is. Some masking, some hand washing, some social distancing is really enough to significantly cut down on influenza.
According to data from the CDC, between September and January of the 2019 flu season, the United States reported about 65,000 cases. In that same time frame in 2020, just over 1,000. Last season, 195 children died from the flu. So far this season, 1. And if you take a look at this CDC map tracking nationwide flu activity, every state is in the green, indicating low to minimal numbers.
We've had significantly lower numbers of individuals coming in with the flu.
Doctors and healthcare providers crediting pandemic safeguards with keeping other seasonal viruses at record lows. But with similar symptoms, how do you tell the difference?
Most of the time with the flu, you're going to have a lot of body aches, chills. But with the coronavirus, we're seeing people coming in with shortness of breath, loss of taste, and sense of smell.
Those on our front lines say they're just relieved they can stay focused on COVID-19.
We are very happy we're not seeing a flu surge, because if we saw a flu surge, I don't know where we would be putting patients.
Now, numbers from the CDC also show that last flu season, just over half of Americans received their flu vaccine. It was 175 million doses. That was record-shattering. This season, so far, keep in mind it's only January, almost 193 million doses have been administered. Health experts still saying and suggesting to get your flu shot, it's not too late. And of course, if you're eligible to get your COVID-19 vaccine as well, they say that's your best chance at protection. Reporting live in Dallas tonight, Marky Martin, News Nation.